Thank you, Mayor. I'll invite everyone to go to the website, chicago.gov/coronavirus. If you click on the tab Latest Data at the top, you'll see that there is much more detailed both demographic and geographic data than we've been sharing. And Chicago Department of Public Health will be sharing these detailed demographic data every day moving forward, being updated in the afternoon in conjunction with the governor's press conference. We'll also be updating maps 3 times a week and are testing maps weekly. So I want to give a little bit of context and more detail for COVID cases in Chicago residents. So among the 11,256 lab-confirmed cases in Illinois, 4,680 have been in Chicago residents. And out of the 274 deaths in Illinois, 98 have been in Chicago residents. All along online, you've been able to see that we have cases in every zip code. We have cases in children less than 1 and seniors of 100 years and older. But today is more about geography, demographics, and that means in Chicago, it is also a story of inequity. So let's start with age. From the beginning, we have been emphasizing the much worse outcomes that we see around the world in people who are older, over 60, even more over 70 or over 80. And I want you to know that that is just as true here in Chicago as it is around the world. So the data show cases in each age group, but especially where we look at those with more severe illness, hospitalizations, ICU, and deaths, we really see age. Fewer than 1 in 5 Chicagoans is over the age of 60. And just 1 in 12 Chicagoans, 8%, is over the age of 70. But almost 1/3 of Chicago's COVID-19 diagnoses have been in people over 60. And most strikingly, 71% of Chicago's COVID deaths have been in people over 60. And half of our deaths have been in people over 70. So again, 8% of our population in Chicago is over the age of 70. 50% of our deaths have been in people over the age of 70, reinforcing, again, this vulnerable population, the need to do everything we can to help protect people in the older age groups, the most important folks to be keeping at home and not interacting with folks outside the household. Secondly, underlying conditions. So again, from the beginning, we've been talking about the importance of underlying conditions as putting people at more risk for the severe outcomes from coronavirus. And when we look at our deaths in Chicago, though we're still finishing the investigation on 9 of the cases, among the other 89 cases, 97% had underlying chronic conditions and 3 did not. Most common are diabetes, cardiovascular disease, including hypertension, and lung disease. So again, what we've seen around the world, we're seeing here in Chicago. Third, I want to talk about gender. While half of Chicago's confirmed cases have been in men, as you would expect, we're split 50-50 men and women as a society, 63% of Chicago's deaths have been in men. And this is actually also consistent with patterns we've seen around the world. We do believe there are some biological differences between men's and women's immune systems that play a contributing role. You can watch my Facebook stream as we'll talk about that some more. But studies have also shown that men, as compared to women, have higher rates of death from chronic disease, are less likely to seek medical help, are more likely to smoke, and actually are less likely to wash their hands and to use soap than women. We'll talk more about this, but I think it's important for men, and especially older men, to hear this, and for their spouses and family members to hear this, to ensure that you're being as careful as you can, keeping your chronic diseases in as best control as you can, not waiting if you're sick to seek medical care, and practicing the really important social distancing and hand hygiene. And then finally, I want to talk about the most important part of this data, which is geography and race ethnicity. So we have some maps, and again, you can see them on the website in more detail. But right here to my right is about Chicago's case counts by zip code. These are just the numbers of individuals in each zip code that have been diagnosed with COVID-19. And the darker represents more individuals. So you can see that down in the far south and southeast and up in the very north are where we've seen the most cases by zip code. But you can see some patterns throughout the city, not very dissimilar from other patterns that we see where we look at chronic diseases and other issues at the Chicago Department of Public Health. Online, you can see more information about the rates, where we actually correct the number of cases for the underlying population. So I encourage you to take a look at that. In addition, further to the right, we actually see our testing numbers. This is the first time that we're reporting these as well. So in Chicago, we've had approximately 15,100 cases that have been, 15,100 tests, that we've received results on. And within that, we've then had our 4,603 cases. We do think there are additional tests that have been done, but we're still having some issues sometimes getting negative test results back through the electronic system. And the health department at both the state and city level are working on this. But if you look at our testing rates, again, dark means more. These are just numbers of tests. And so you can see that we actually have had more testing similar in the same areas where we've had more cases. And that's because all along where we've seen cases and the health department has been doing investigations, we've been working to bring testing into settings where it's most needed. Also doing that in congregate settings, like our long-term care facilities, our homeless shelters, our nursing homes, and people who are sicker, who are hospitalized, certainly needing ICU care. Those folks are absolutely all getting the testing. And so some of the higher positive rates that we're seeing are because we still do not have the widespread testing available in Chicago that we're hoping to see soon. So let's talk more explicitly about race and ethnicity. Here in Chicago, geography often is a stand-in for race and ethnicity. But if we look explicitly, at the Chicago Department of Public Health, we've been talking about not just health inequities, but racial health inequities for a long time. As part of our Healthy Chicago 2025 plan, we've really highlighted it around the 8.8-year life expectancy gap that we have here in Chicago. On average, a white Chicagoan lives 8.8 years longer than a black Chicagoan before COVID. What drives that gap? The biggest driver, more than half of that gap, is being driven by chronic diseases, cardiovascular disease, lung disease, smoking-related illnesses, diabetes. These are the very chronic conditions that put people at risk for severe illness and death. And if we look at some of that for just a second in black and brown communities in Chicago, again, forgetting COVID for just 1 second, diabetes rates among blacks in Chicago are double the rates of what they are in whites in Chicago. Lung diseases, deaths related to lung diseases like COPD are more than 20% higher. Almost 2 of every 5 black adults in Chicago has been diagnosed with high blood pressure, a rate 25% higher than whites. Almost twice as many black adults live with asthma as compared to whites, and almost twice as many black adults smoke. These underlying conditions are part of what are driving some of the racial inequities. But these inequities also reflect the conditions in which people live. Let's take diabetes. Even if we had a perfect healthcare system in which anyone could access a doctor, anyone could get the medications they needed, we didn't have any of these access issues that we're constantly working on, we would still see significant health disparities. That's because in many of our neighborhoods, it's hard to access healthy food because of high cost, few grocery stores. We don't have equal access to safe, walkable streets. people living in higher stress environments where there may be more exposure to violence, or people who are working multiple low-paying jobs to make ends meet. And fundamentally, the community conditions, the holes in our social safety net, differing economic, educational opportunities, and fundamentally the systemic and institutional racism that have driven these inequities over the years, we are now seeing play out in our COVID data. So let's talk about the rates. First of all, as a city, Chicago is 33% white, 30% black, 29% Latinx or Hispanic, and 7% Asian. Among those for whom race ethnicity is known, as the mayor said, 52% of our COVID diagnoses have been in black Chicagoans. 30% of Chicago is black, 52% of our cases have been in black Chicagoans. And most strikingly, 72% of our deaths here in Chicago residents have been in black Chicagoans, though again, black Chicagoans just make up 30% of the city's population. This last graph on the right here points to the differing death rates, where we see that the death rate right now in the cases that have been reported for non-Latinx blacks in Chicago is 7 times the death rate as it is for white non-Latinx. And you can see where Latinx, Asian non-Latinx, and other non-Latinx fall in. Much more detail, again, available on the website. But by and large, this is not, I'm sorry to say, a surprising story. It is one that demands action in a short-term way and in the way that we will be working on for decades to come. And I can think of nobody who has already taken a stronger stance on this, who has been a supporter to the Chicago Department of Public Health as we talk about this, and has been focusing on the poverty agenda and what it means to truly address inequities in Chicago than Mayor Lightfoot. I'm going to turn it back over to her to really go through some of what we together as a city need to do urgently to get this news out, to reinforce the science, and to make sure as a city we're doing everything we can to help get ahead of this.